Hi, I'm Dr. Sam Sunshine from OC Sports and Wellness. A little technical glitch there. I am a family and sports medicine doctor in Foothill Ranch. What? Can you still hear me? Okay, so a little bit of technical difficulties. I apologize. We can't currently see the screen right now, but try again. All right, we're gonna go forward without being able to see the screen, but hopefully you can hear us okay. I have a great guest today, Chris Phillips from Compete Sports Performance in Lake Forest. He wears many hats. He's a personal trainer. He's an athletic trainer. He's certified as a strength and conditioning coach, and he does rehab as well. So, Chris, tell us a little bit about yourself and maybe some of the teams and organizations you've worked with.
Sure. So background, I'm an athletic trainer, strength conditioning coach. Started out, been lucky, started out in pro sports. Right out of college, spent 17 years in professional hockey as an athletic trainer. My last 8 years with the Ducks and the Capitals in the National Hockey League. Prior to moving on to pro football for a couple of years and then open up Compete in 2009. Big thing about me is the big thing is really to start to understand how do we get athletes to become better? How do we get athletes and the general public to feel better, recover from their injuries, and do the things that they really want to do?
That's awesome, Chris. So again, I think we were speaking earlier that you've been in clinical practice for 25 years. Today's topic is going to be on sports concussions specifically, how to diagnose concussions and how to treat them. What are some of the common sports that you see where you see athletes that come in with concussion symptoms?
With my background being in hockey, and then ever since we opened, we've done a lot of professional soccer as well. Those are our two main sports. So I would say hockey and soccer are obviously our two biggest sports for concussions. We do see a lot of football as well, but mostly on the injury side. It's your collision sports, and even on something like soccer that we don't think of as a collision sport, it's a sport that does produce a lot of concussions, unfortunately.
All right, so let's just talk about the definition of concussion. That's going to be, it's basically any time you have symptoms following a traumatic injury that affects brain function. Mm-hmm. If there's another way you could state that, or if you want to paraphrase definition of concussion.
To make it as simple as possible, it's something that affects the way your brain works, whether or not that is a headache or cognitive on how you understand different things of working, or your balance, or your ideas of how can I focus, and I can't focus, or foggy. Sometimes it affects your visual. And they come after, again, yes, a traumatic injury, but a lot of times it's just a clash with another force, whether or not that's another athlete, whether or not that's the ground, whether or not that's an implement such as a ball. And one of the things that we see too is that it doesn't have to actually be a hit to the head to cause concussion. I would say in my 17 years of pro hockey, I would say 25% of our concussions had no direct blow to the head, but a direct blow to the chest or the shoulder that actually rotated or moved the head, where the brain actually, for lack of a better term, sloshed around inside and bounced off the inside of the skull.
Yeah, great. So again, it can happen in any sport, any position, to any player at any time. And that's what we see. You know, again, I haven't evaluated a concussion in about 6 months because we're in the midst of COVID. No one's been playing.
Yep.
And so I really haven't seen too many concussions. So it is kind of interesting, a little bit rare. Football season is gearing up. Again, we're not going to be having a high school football year, I believe, this year. We'll see about other sports, but I think those are going to be postponed until the winter or spring. So we'll probably, again, won't see a lot of concussions, but we'll see if those things start to open up.
And to just add on, we've seen a lot of concussions in cheer. We do a lot of cheer athletes. and simple things of water polo that you don't even think much about. Sports that still have are very physical, or very athletic, and you don't think much of, oh, well, how many cheerleaders get concussions? Well, water polo, how many water polo? It happens, and that's the thing. It doesn't have to necessarily be a full-on, collision sport to have to have these types of injuries.
Yeah, and that was something we talk about, is that you just never know. Now, the other thing too is athletes oftentimes are not educated on symptoms of concussion. So a lot of times they don't know what that feeling is after they have their bell rung, let's say, and they might feel a little bit dizzy and they try to tough it out. I think athletes are accustomed to playing through pain, but we feel that an ankle sprain where they just come to the sideline and get it taped versus a head injury with symptoms of fogginess, loss of short-term memory, nausea, headache is very different. And athletes need to be educated not to go back in. Again, you and I both do sideline medicine. Maybe you can give us some insight as a health professional giving care to an athlete where you suspect a concussion. What are some of the things that you might do to look for a concussion?
I think right off the bat, when we talked about it earlier, is letting the healthcare professional, whether it's the athletic trainer or the team doctor that's on the sideline, know what's going on. Let us help make that decision, because big thing, like when I first started, yeah, if you had a headache after you got hit, a little dizzy, we shoved it off and said, okay, we're fine, you can go back and play. And as sports medicine has progressed over the years, we've learned that that's not the right thing to do. And I get asked all the time, hey, when this had happened down the road, would you have done the same thing and treated it the same way? And at that time, yeah, I would have. Mm-hmm. If it was today, no, I wouldn't have. Yeah. Because we've learned more. From a sideline aspect, we're always trying to watch everything. We don't just watch the right play. We watch every time play ends. What are we doing? Counting numbers on the ground, making sure we have the same amount. If a kid gets hit in a football game, we're going to look and see, hey, how does he look? There's times where we might even look and he gets hit hard, but we're not going to stop the play because hard hits occur. But we might look at the coach real quick and go, hey, does he look right to you? And then if not, then we pull him off. Or if the referee notices, then we pull him off and go through an evaluation. Anywhere from a quick to a longer, more standard evaluation, especially with today's state laws, that if we suspect a concussion, we need to remove them. So, and that's irregardless. Like it's a black and white rule. The state made the change a few years ago, and we follow it to the T. So sometimes with our evaluation, we may shorten that a little bit because we know we need to pull the athlete. The athlete's going to have to go see the doc. Period. End of story. There's other times where you can evaluate and you go, okay, well, so far everything's been normal. Everything's been normal. We'll go over memory. We'll go over what's called a VOMS, which is a visual test with the eyes. We'll look at balance. We'll ask for symptoms. And unfortunately, with a head injury, some athletes will try to just tell you what you want to hear. And that's what we have to try to pull out of them, or we have to be able to understand the difference of when they're telling us the truth and when they're not. And that's an issue at times because some athletes don't want to tell you because they do know the state law and they do know that they say they have a headache, you're going to pull them. So that's, the unfortunate part. But again, it's for their health and safety. I look at it this way with any athlete. I don't care. We work with professionals that have played into their late 30s and 40s. At some time, your sport's going to end, but you're going to continue to live on. So we want to make sure that they're healthy adults long term and not see some of the kids like we do see now that are suffering from concussion symptoms 3, 6, 9 months down the road.
Yeah. And the other thing we touched on too is that sometimes you can have very mild symptoms after a big hit or hitting a soccer ball. And then those symptoms can progress over a short period of time, over hours or days, to become quite severe. And we typically see that. So what are some of the things we do is monitor them.
Yeah.
You can talk a little bit about the monitoring.
We had one with the Ducks. I remember it sticks out clear as day. We had a guy that had concussion history, had been fine, been playing, and he got lit up one night. And evaluated him on the bench, spoke with him on the bench. Everything was fine. 5 minutes later, period's over. Went back in the locker room, talked to him again, evaluated him again. Everything's fine. We have about an 18-minute break. And towards the end of the break, he walked into my office and said, hey, something's not right. and he was fine for the first 15 to 20 minutes after the hit. He was fine, and then all of a sudden it just clicked, and he got dizzy, he got headaches, he wasn't seeing straight. And that's one point that always stuck in my head, that just because they get hit and they're fine 30 seconds later doesn't necessarily mean they're going to be fine 30 minutes later. Or some kids are fine that afternoon and then they wake up the next morning with issues, or they don't notice until they go to school and they're struggling in school. And that's always my tip off, is if the next morning we get a call going, hey, I had to take the kid home from school. No, out. Like, there's just a flat out, because they struggle with either the noise or the lights or the comprehension. And that's where it's the, no, we're straight and sending them to somebody like yourself who understands the insides and outsides of a concussion.
Yeah. So that's the other thing. First, I want to touch on just gender differences and also the age of the athlete at the time of the concussion. And we spoke about this too, that if you have a younger athlete, and certainly a female versus a male concussion, you're going to see oftentimes more severe and prolonged symptoms. Mm-hmm. Has that been what you've experienced in your career?
I definitely see more female concussions versus male concussions. There's 8 million research theories that tell you why. One thing that I've noticed is most of these kids are going to be in that junior high school age, and the males are they're stronger at that age, and they can take the hit, they can absorb force better. When you look at some of the concussion research, the stronger your neck is, the more you can actually absorb that force. Therefore, the actual incidence of concussions start to go down. That research is pretty well proven, and I think, as you see in that 14, 15, 16-year-old athlete, the male is typically a little bit stronger than the female. I'm trying to be sexist, just telling the truth that that's kind of how it is. And what we've really seen, and again, we see it a lot in soccer, is as we get these girls stronger and more stable, they are able to resist that concussion, and as well as a lot of other injuries a lot better.
Yeah, and again, touching on the fact that even female athletes, just as much as men, will hide it and not report it if they have symptoms of a concussion. Again, it's that learning to play with pain and that it's okay. Again, concussion's different, because if you're playing with symptoms, and if you have the unfortunate situation where you get another head injury, you can have compounded symptoms that can last for months or years in some athletes, and it can pull you out of your sport for the entire season. So it's something, as a parent or as an athlete, you want to take head injury very seriously. And again, sometimes, like Chris pointed out, it's not necessarily getting hit in the head. It could be a body blow where you get a rotational force on your head, almost like a whiplash type injury, or having contact with the ground, mm-hmm. or a piece of equipment, like a baseball or something, or a soccer ball, for instance. And I think it's really important that people, when I say people, athletes, parents, I think the athletic trainers, it's been it's been pounded into our heads of how to manage concussions. It's very easy for us now, because if you have any symptoms after a head injury, for your safety, we've got to take you out of the game. And that's hard for a lot of athletes and a lot of parents to understand, but it's for the athlete's best interest. Other things we want to talk about is following athletes, like on a day-to-day basis. Again, you can see athletes, and you're going to have oftentimes a chronologic form. Maybe you can talk about the SCAT testing and how that works, and how we can follow progress of athletes.
I think one thing that's important is with a lot of our athletes, in our clinic, we're only going to see them 2 to 3 times a week until they start to get better. But with our athletes that we deal with at the high school, we deal with at the clubs, they do a daily symptom checklist. So they have to rate all their symptoms, and there's just a normal form of like rate your headache 0 to 5, rate your balance, rate your fogginess, and there's simple things that we can go through, and we have these athletes do them every single day.
Yeah, so it's kind of
a little simple checklist, and we have them do it every day, and then that way we can kind of follow along, and it makes it easier too. As one of the things that we discuss with our docs too is what makes your job easier. what information do you need from us to make your job easier so that you can make the proper decision? And then I think one of the big things, and we've discussed before at our concussion consortiums, is everybody working as a team. And if everybody's on the same page and everybody works together, it tends to work out in the long run.
Okay. I hope we're on. Are we still on?
Oh, yeah, you're doing great.
Okay.
Awesome.
All right. So again, a little bit of technical difficulties. Hope you're still with us. Also, if you are listening in live, we'd love to hear who you are and what city you're from, if you don't mind typing that in. And then in a few minutes, we'll open it up for some questions and answers. Again, concussions can be quite serious. They can become progressive. The younger you are and being female gender, higher risk. Again, our job as providing concussion diagnosis is to protect you as the athlete. What I do tell parents and athletes is that before you can go in and play, you've really got to get back to baseline. So that's rule number one. Before you can go back to playing, you've got to be back to how you were feeling before the concussion occurred. And that's really important. In the state of California, and I think in many other states, the Centers for Disease Control and their Heads Up program, which you can find at cdc.gov/heads up, goes through all the criteria for returning to play. And it's something that we follow very closely. It's mostly administered by the athletic trainers or the physical therapist at the school or with the organization. Rule number two is that post-concussion symptoms in athletes almost always resolve within the first 1 to 2 weeks in 80 to 90% of the cases. Fortunately, it's a small percentage that go on to have persistent symptoms, and those are the really difficult cases to manage. Chris, what's been your experience with the people who just don't get better in those first couple weeks? How do you manage those patients? Those are the ones that are the tricky ones.
I think that goes back to our team relationship. So a lot of what we're going to do is I might get somebody that's still symptomatic that comes from from the docs. We start to do what we're going to do, which is going to go through some balance exercises. We're going to go through some visual exercises. We're going to go through just ramping up the heart rate a little bit and seeing how they react. And then when we see what causes an increase in a symptom, then try to realize, okay, that may be what's causing a problem. So in other words, if we're dealing with a hand-eye coordination exercise and that makes them struggle, then we go back to the doc and say, hey, maybe we need to send this to the neuro-ophthalmologist. Or, hey, now all of a sudden, hey, it's the balance is off. Okay, maybe we never send them to the vestibular physical therapist. Or, looking and trying to go through what the cause is. Or sometimes it's dealing with the sports psychologist, because sometimes they do great with us and we can push them as hard as we can. And then as soon as they get to a light practice, they get really nervous and that causes an issue. Maybe we have to go to a sports psychologist. So that's one of the things of trying to understand that athlete better and then working as a team to go, hey, this is what I see. What do you see? What's our best form to move forward to get that athlete better? And it's not one size fits all. It's definitely a different size every time.
Yeah, and kind of just to expound on that a little bit, I'm going to take over a little bit of the conversation now, because one of the nice things that was started probably about 5, 6, 7 years ago by a guy named Mike Lamb is he was working at Wells Fargo and they started this concussion awareness or concussion care or safe play concussion care system. And they kind of recruited the local doctors, local therapists, ATC, neurologists, neuro-optometrists, kind of like you were talking about, Chris, and brought everyone together so we knew who each person was that understood how to deal with brain injury. Again, it's very hard to predict who are the athletes that are going to go on to have persistent symptoms, but it can be very devastating. They may have to be out of their sport for a year. They may have to come out of school for a quarter or a semester because they just can't concentrate. This has been great. Chris Katoris, a doctor, a pediatrician, David Cruz and their family and sports medicine doctor have kind of spearheaded and maintained this consortium for concussion awareness. We have great speakers that come. We meet a couple times a year, but it gives everybody a chance to say, hey, this is our team. If you have questions, these are who you're going to refer to. Maybe you can talk a little bit about your experience being part of that consortium.
Oh, I get, again, it allows us to get together, meet great people like yourself, and that's how we first met. and start to understand how can we all work together, because at the end of the day we all want that athlete to do better. And my feeling is, as long as the athlete does well, then everybody involved did their job. So a big part of it for me is starting to understand everybody's role. We always look at that family sports medicine or the pediatrician that deals with the concussions, or just your general good sports medicine doc. To us, is he or she's always at the top. Everybody else is below. That's the manager, and then the team below works together, reports back to the manager, and then in the long run, it doesn't matter. And I think the great thing about the consortium is everybody knows where our strengths are, and there's no egos. And I think that's one thing that's been great, is that we can all just get along, and I have no problem going, hey doc, I think maybe you missed this. What is wrong with this? And you get oh, okay, yeah, let's look at that. And I think now at that point, everybody just is open and listens and deals well together, because at the end of the day, we just want that athlete to get better.
And that's really true. We don't gain anything by keeping an athlete out. That's not our.
I don't know.
Our
job is to keep them up. My job as an athletic trainer, no matter what the injury, is to keep you on the field, not take you off the field.
Yeah. And again, like we were saying, is if you get that second concussion while you still have symptoms of a concussion, your symptoms can then be amplified and exaggerated, and they may last longer. So again, if you're an athlete, you want to heed this warning that if you have a head injury, it's better to get it managed quickly by somebody who knows what they're doing. Again, having this consortium of people, allies, that we can work together. So there are now considered 5 or even more subtypes of concussion. Again, I'm going to kind of steal the mic again, but you have predominantly headaches, or it could or migraine. It could be emotional or mood. It could be a coordination. It could be vestibular, which is your balance, or visual, what they call an ocular condition. And these are all treated differently. Again, Chris alluded to using sports psychologists for people who need maybe some cognitive behavioral therapy that works really good for anxiety and depression outside of concussion, but it can still help to some degree with patients who've had a concussion. We work with neuro-optometrists. There's a couple people in the group, in the team, that specialize in that, because sometimes you get like muscle entrapment in the eyes, and they can work through that. You might have what's called a disconjugate gaze, where you're looking at things and your eyes are not coordinated. These experts, these specialists, can help athletes with that, and it just makes a big difference. And then neurologists can play a huge role, and if you want to add to that.
I think one thing, and you mentioned it earlier, is when an athlete gets injured and gets a head, especially in a head injury, but any injury to a point, but a head injury is an example, they need to go seek proper help first and right away. And you want to find a physician that deals with sports-related concussions on a daily basis. Obviously now pandemic, it's a little bit different. But normally, like, people that are very well versed in it, have dealt with a ton of these, and get them in right away. Because the ones that we find, that's one of the ones that we find that struggle, are the ones that mom and dad just keep them home. They let them rest for a couple weeks. Maybe they see the pediatrician wants them just to stay home and rest. And then all of a sudden we're 3-4 weeks down the road and we're running into a lot of issues. Not only are they still having concussion symptoms, but they're now deconditioned. Now they're more emotional. When it could be something that might be a neurological issue that could be handled fairly quickly. And instead of waiting that 4 weeks, to me, it's, hey, within those first 3 to 4 days, we need to get them into a proper physician.
Yeah, so very well said. I think we're going to continue a little bit longer. Normally we'd be opening this up to some Q&A, but just a couple other things that I want to touch on. And one is there are no FDA-approved medications for concussion. This is where medical doctors come in. If we have some patients that are athletes that have persistent symptoms, if it's more of an emotional thing, sometimes we can use medications to help with neurotransmitter function. If it's a headache thing, there are medications we can use, from beta blockers to tricyclic antidepressants. Again, these things can calm symptoms. And we've had athletes that maybe the headache is the predominant symptom. We calm that down with the medication, and then all their other symptoms, like their nausea, their anxiety, their neck pain, seems to go away as well. So we can see that. I'm a big fan of supplements. I won't get too much into that today, but things like fish oil, magnesium, vitamin D, and etc. There are things that have been postulated as helping, and maybe some small clinical trials that have maybe shown some benefit. But again, no FDA-approved medications that have been found to be efficacious to treat concussions. Again, concussions vary with their presentation. Excuse me. So they vary with their presentation and also the treatment. It varies per athlete. So Chris, I don't know if you want to touch on that at all, or things in your experience. I know that's kind of outside of your wheelhouse.
Yeah, I mean, I think with either the medications or the supplements, I kind of leave that up to you guys. You have more experience on that, know more of the research better than we do. Going back to the treatments are they're going to vary. Like, we have our basics of this is how we want to do things, but everybody, it's just like any other injury. We want to evaluate that injury and then decide what's the best course of action. And then if things aren't working the way we expect, then we have to kind of reassess, are we doing the right thing? Reassess if we're missing something. Reassess, do we need to send back to the physician or talk to the physician of going, hey, this isn't going the right way, and we need to reevaluate and find a different way because we're not getting the results we want.
Yeah. And then I remember the point I wanted to make, and you had mentioned this. You know, sometimes if people go down the wrong channel, maybe see the wrong person, wrong healthcare professional, and treatment gets delayed several weeks, athlete gets deconditioned. We know one of the best things for athletes is to stay active and to continue to exercise, but keep that exercise at sub-symptom threshold. That means you can get on a stationary bike or go for a jog as long as it's not giving you a headache, making you nauseous, making you feel dizzy, giving you sensitivity to light or sound. And you want to, by all means, maintain that fitness and get exercising. The other key thing that's super important before we open this up to Q&A is sleep. You know, sleep is where our body and our brain regenerate, and getting an extra hour or two, taking naps. Again, these are for the people who've had that persistent symptoms beyond 2 to 3 weeks. Really important to be aware of. So sleep, and then maintaining fitness level, because that's been shown to expedite the resolution of a concussion in sports.
And I think one thing as we head into a holiday weekend, one of the things that we've noticed is when school-age athletes in school, when they hit the breaks, this holiday weekend's a little bit shorter, but when you hit like the Christmas break, the Thanksgiving break, spring break, a lot of kids really start to turn the corner at that time because they've had more time to sleep. They've had more time to rest. And we find and it was something that I didn't know in the beginning and started to recognize more and more, that they do better. And you also see that for some reason, the concussion kids will return a little bit faster in the summer when there is no school. So I'm not blaming school at all, and you should not go to school. But at the same point in time, that extra function is going to slow things down a little bit.
Yeah. So if you're straining, so again, staying away from the television, the computer, your cell phone with that acute concussion, absolutely critical. That's stimulating your brain in ways that we probably shouldn't. The other point is, when we talked about the rest, the exercise, and then we can make as medical doctors, we can make academic accommodations. So you get more time for test taking, and then we can actually take students out of school. If you have a school psychologist, this is at the high school or college level, and some schools do, working with a school psychologist to help advise teachers in making academic accommodations. So that was a lot in a short period of time, so I want to thank everybody. If there's any questions, please ask them. Now would be a great time. And as we're waiting for questions to come up, again, Chris, if you maybe can give our audience some more information of where you're located, how to get a hold of you, your website, and so forth.
Yeah, so it's Compete Sports Performance and Rehab. We're located right on Dimension in Lake Forest, so about 2-3 minutes from OC Sports and Wellness. And it's CompeteSportsPerformance.com is our website. All our information's there, contact information. We're always there to help. So even if you have a question, please reach out to us. My email's on there as well. My goal when I opened was to make sure that we could bring what I brought to the professional athlete to the general public, and that's still the way we operate.
Yeah. So Chris, again, thank you for taking the time out of your busy schedule to come and hang out with me, educate, again, the parents as well as the student athletes about the importance of concussion. Again, rely on a healthcare professional who understands concussion. And as we found out, there's not a lot of us in North or South Orange County. So just ask around. And most of the people who are in the know with concussion management know who the people are that can help your son and daughter, or if you're the athlete, help you with concussion management. At this time, no questions, so we're going to wrap up. It's been about 30 minutes. I apologize, but we've had a few glitches with the computer. We'll try to get that ironed out next time. And Chris, maybe we'll get you back on for maybe another topic down the road.
Well, thanks for having me.
Thanks so much, Chris. So I do that, then I got to